So let us take another question from INICET 2020 of medicine. Let us discuss a question of medicine. So patient comes to the emergency room with a chest pain of 3 hours duration. Patient has come to the emergency room with a chest pain of 3 hours duration. It is important because in a case of myocardial infarction, the window period for thrombolysis is up to 12 hours. The window period for thrombolysis or emergency reperfusion thrombolysis is up to 12 hours. So the patient has come within the window period if it is applicable. And normal blood pressure. So the patient is hemodynamically stable. ECG shows ST depression with T-wave inversion. ST depression with T-wave inversion is suggestive of subendocardial ischemia. It is suggestive of subendocardial ischemia, or we can say there is ischemic changes are present on the ECG. But please note, there is no ST elevation. There is no ST elevation MI is not present. If ST elevation MI is not present, then there is no indication for PCI. There is no indication for thrombolytic therapy also. No indication for PCI, no indication for thrombolysis. So when there is no ST elevation and the patient has chest pain, the probable differential diagnosis are the patient is either unstable angina or the patient is having NSTEMI. So the two differentials that you have based on the given information, patient can be having either unstable angina or NSTEMI. If the patient was unstable angina, all you had to do was antiplatelet therapy only, antiplatelet only. But if it is NSTMI, then you will have to add anticoagulation in the form of heparin. Low molecular weight heparin or unfractionated heparin would be recommended in this patient. So how do we differentiate? Based on the troponin level. Troponin level are 140. Troponin is elevated. If the cardiac biomarkers are elevated, it is suggestive of infarction. And biomarker positive is the definition of NSTEMI. So the patient is suffering from NSTEMI. So there is no question of doing PCI or thrombolysis. There is no question of prophylaxis of arrhythmia, but the treatment is to offer both antiplatelet with anticoagulation to prevent reinfarction. This is the best correct answer for this question, right? I hope you get that. Approach is the key to this question.